Dr. Jarvis, Paul, are you ready?
We are.
We are.
Okay, take it away, gentlemen.
Good afternoon, and thank you again for joining us. As usual, we are wearing our face coverings, and some of these were made in partnership with Intention, and we're happy that we have that cooperation and community support. Our staff here are also wearing theirs, but to improve the audio, we are going to remove our masks. So I'll start off with some numbers like we've discussed in the past. Currently, there are 19 patients who are positive for COVID-19 under Northern Light Healthcare's care. One of those is at Eastern Maine Medical Center, 6 of those are at Mercy Hospital, and then 12 are being cared for at home by our home care and hospice services. To date, Northern Light Lab has run 10,234 tests, with 271 of those being positive. COVID-19 remains a critical health concern across our state and particularly local communities. This threat continues and is very real, and we feel that it will be here for some time. In the past couple of weeks, we have talked about some of the measures that we have taken to safely engage patients and allow them to continue their health care for both acute issues and for chronic illnesses. And today I want to go over a little bit more specifically some of the things that we will be doing. First and foremost, everyone coming into one of our facilities will be screened with a series of questions and having their temperature taken prior to coming into our facilities. And we do that for both staff as well as patients and visitors. As I mentioned last week, we are able to test more people, and the numbers of today's number of testing has certainly shown that. We anticipate that we will not only expand beyond the limited number of individuals we are testing now, but be able to test more patients who are symptomatic for COVID-19 in the coming weeks. In addition, we also hope to be able to do screening testing of individuals who need to be admitted to our facilities for non-COVID related activity. That would be a great help to us in order for us to make sure that we are keeping our patients, visitors, and our staff safe from this disease. You will see a series of new signage as you come into our facility. When you do that, you will see these signs that will actually talk about some of the things that we are taking place for your safety and for the safety of others. That includes that we are asking that all individuals who enter our facility are wearing face coverings. Those can be masks or cloth face coverings for our general public, patients, and their visitors. All staff will be wearing medical grade masks during their interaction with any of our patients in one of our facilities. It is extremely important that we do this. This is the way that we can remain safe. While we need to continue to do social distancing and remain 6 feet away from individuals as much as possible, an added layer of protection to that is face coverings. We also know that during healthcare encounters, there are times when we have to be within 6 feet, and therefore those face coverings further assist us in the ability to remain safe. In many areas, you will see stickers on our floors that remind us about social distancing and the importance of social distancing. You may see that you come up upon an area where plexiglass separates you from, say, a receptionist or other one of our staff in order to protect both of you from the spread of this virus and still facilitate making sure that we can do good care. Our environmental control folks have also continued to do the good things that they have always done to keep our facilities clean, sanitized, and safe, but we're going to be a little bit more out in the open about that. When you go in and you see one of our carts, you should notice that there are many different cleaning supplies there in order to disinfect any part of an area that a patient may come in contact with. We will continue to do good hand hygiene, making sure that we are washing our hands or using hand sanitizer both before we do a procedure or a visit and afterwards. If you do not see us doing this, please remind us that we need to. We want to be as transparent as possible to make you feel as comfortable and as safe as possible. We have continued to put patients who are positive for COVID-19 in isolated areas within our facilities in order that we can make sure that those individuals who are not infected with COVID-19 can stay as far away and as safe as possible. And we will continue to do that as we go along. And we will also remind you that visitation is limited at all of our facilities, not just our hospitals, but also in our acute care facilities, our nursing homes, and our ambulatory clinics. We state that no more than one person may accompany a patient when they come in, and then we will make special accommodations as need be for certain individuals who have particular needs. And with that, I'll turn it over to Paul to talk about some of our community collaborations.
Right. Thanks, Dr. Jarvis. Just part of the follow-up that we've been doing with community partners throughout the state are working with community businesses in terms of supporting them in their reopening and re-engaging with their customers. So we continue to do that throughout the Northern Light footprint, which is statewide, working collaboratively with them in that way. In addition, the signs that Dr. Jarvis held up earlier promoting face coverings, hand hygiene, and social distancing are available for anyone to download and print for their use in their business, in their home, or wherever they find it to be helpful. We're again working with numerous community partners and businesses to ensure that the word about masking or face coverings, social distancing, hand hygiene, and the like are very much commonplace and the norm out in the community. If these things are adhered to, it allows our state to open more quickly and safely.
Thank you, Paul. And touching on that, I did want to talk about that there have been some reports suggesting that the CDC has updated their view on how this virus has been transmitted because they made some updates to their website. However, that was just to clarify some things that we already know about this virus and its transmissibility. What we know today is consistent with what we have been saying for at least the last few weeks, is that this virus is mainly spread from person to person, and that it is spread through a respiratory transmission, that those droplets of moisture that come out of our mouth and nose as we speak, sing, yell, sneeze, cough, are the primary way that this virus is transmitted. It's the reason why social distancing and face coverings are so important. In addition to that, hand washing is important as well, because we do know that some of those droplets can infect particular areas that we use on a regular basis, such as our cell phones, our keypads, our keyboards, and other high-touch areas. However, we do not feel that the virus, and we have been saying this for a while now, is just in common touch transmission. So it is safe to go out to the grocery store, and the products that you purchase do not need to be treated any differently than you normally would. You should be washing your fruits and vegetables with water like you normally would. If you do feel a little bit insecure about the packaging, certainly wiping it down with a wet cloth is perfectly fine. Similarly, mail and packages delivered to our house carry a very low risk of transmission. The transmission really is from person to person with respiratory spread, and that's the reason why we continue to talk about social distancing and face coverings. And with that, we'll open it up to questions.
Thank you very much, Dr. Jarvis and Paul. Our first on tap today for questions is Brian Sullivan from WABI. Once you see that you're muted, Brian, go ahead and ask your questions.
Okay, thank you. Dr. Jarvis, I got two, which I think will be for you. The man in his 60s who passed away yesterday from with the coronavirus, can you tell us, was he in the care of Northern Light Health?
I can tell you that yes, Eastern Maine Medical Center did have a recent death from COVID-19. As is our policy, we will not talk about specifics about any one patient. I will say that our empathy and feelings and thoughts are with the families, friends, and communities of all who died, including the individual you just mentioned.
And I guess what you just went through with the new signage and the screening, is that all newly implemented steps that are being taken?
So most of these steps are things that we have been doing for the last few weeks. Some of them we have been doing for several months now, including universal masking for our employees and our staff and providers as they come in. Added to that would be the added precaution of face coverings for patients and visitors. Obviously, we have restricted our visitation since almost the beginning of this pandemic. What we're trying to do is get out in front of this. As we see with the reopening of our economy and our state, and that our numbers remain low here in Maine. Unfortunately, some people that gives them a false sense of security that we are through this pandemic and therefore we don't need to do social distancing or we don't need to do face coverings, but it could not be further from the truth in that. We need to continue those things. We do know that we have a risk as we reopen our economy and reopen the state and people gather together that this virus can spread very rapidly. We see that now currently happening in several of our long-term care facilities and assisted living facilities throughout the state, where one individual becomes infected and soon many individuals in those close quarters become infected. As we start to feel the warmer weather and get out and among the public, this is the challenge that we face, and the only way we can protect each other is to maintain social distancing and face covering and doing all the good things that we've been doing in order to keep those numbers low. Thank you, Brian.
Thank you very much, Brian. Actually, a good point, Brian. For those of you members of the media, make sure you let us know right off the beginning who your question is directed at. And with that, next up will be Amy Brown from WERU. Once you see your mic unmuted, Amy, please feel free to ask your question.
Thank you. I actually have a question for each of you. Mr. Boland, is your assistance with reopening available to all businesses as they're trying to figure out how to do it, and how do they access that?
Yes, Northern Light Work Health has been providing support to businesses throughout the state, so that's certainly one avenue. We have some general information that's available, and we'll be working at increasing that accessibility of some of the general no-charge feedback and suggestions that we might have. We're also working more closely with business on a client relationship that would have more particular needs and questions. So I guess it really depends on what the business needs, but we're here to work with our communities, including all of the businesses throughout the state.
So people would contact Northern Light Work Health if they had questions about that?
Yes.
Okay, great, thank you. And Dr. Jarvis, do you think with the screenings that are being done at medical facilities and by some employers, it would be helpful if they added questions? I know now they have questions about whether you've traveled, actually even to southern Maine, in some places are asking if you've had a fever, any symptoms, or exposure. Do you think it would be useful to add questions about whether or not people have been maintaining social distance and wearing face coverings when in public to those screenings?
That's a difficult question. So the question was, should we add to our screening questions things like, have you maintained social distancing and have you been wearing face coverings when you've been out in public places? Right now we follow the guidance of the CDC, and the CDC's website for its COVID-19 symptom checker is still what we recommend that businesses use, as well as healthcare. It is difficult to ask some of those questions, and that becomes challenging for us. All I can say is that we all need to be courteous to one another and remember that when we are practicing social distancing and practicing face masks, it's face coverings, it is not just ourselves that we are protecting, it is the other people around us and the people that we go home to. I had one person say to me today, every time I put a face covering on, I remember I'm protecting someone's grandmother. I think if we all just remind ourselves that we're protecting our grandparents, our parents, our children, our friends, neighbors who have diabetes, high blood pressure, heart disease, cancer, those are the people that we are protecting, and we should all be courteous about that and consider it when we are out in public and even when we go into establishments. This is not the time to be confrontational. If a business leader is asking you to wear a face covering when you go into their enterprise, we should respect that wishes. They have to protect their staff and their patrons just as much as you need to protect your family members, and we should continue to do that. Thank you for that wonderful question.
Thank you, Amy. I'm going to move on now to WVII, ABC Fox 7. DJ, you have any questions?
Thank you, Chris. I'm not sure I have a wonderful question, but I'm going to try my hardest. Dr. Jarvis, when a person enters the healthcare mall on Union Street, Bangor, they immediately have a forehead thermometer swiped across their forehead for their temp there. However, when that person goes further into, say, walking care and is in the treatment room, a medical assistant, nurse, whatever you want, certified nurse's assistant, whatever, takes their temperature by orally and puts the patient's mask down. That seems somewhat contradictory.
Yeah, it does seem contradictory. So the question is why do we use thermal scans or those gun-like thermometers when we're doing screening to come in, and yet we may use an oral thermometer when you're actually in the office visit? And there's really some science behind that. The first is that those oral thermometers are more accurate and give us a more accurate temperature, where the thermal scans we have set what our threshold is for someone not being able to come into our facility unless they are the patient at a higher level than we would for what we need from a clinical standpoint. So it really has to do with whether we're talking about screening versus clinical appropriateness. Healthcare workers in general take a risk when we are doing the jobs that we do, and that's day in and day out, and preceded the COVID pandemic. We are at risk of catching infectious diseases from our patients. It's something that's part of our calling and our mission, and we will continue to do, and we are honored to do so. So yes, there are times when we will have to ask patients to take off their face covering in order for us to perform good clinical activity, take a more accurate temperature, look inside the mouth and nose and throat. And so we will continue to do those things as we need to. When we do that, we will take all the protection for our healthcare workers as well, making sure that they are wearing their personal protective equipment. And it's why they are wearing medical grade masks versus cloth face coverings when they do their routine work of caring for you, our community members. Thank you for that.
Thank you. That was a wonderful answer.
All right, you get top billing next time.
Well said. Thank you, sir.
TJ, you all set?
Yes, sir.
Okay, next up, thank you, TJ, for your questions. We're going to move to Isha Pendekar from Bangor Daily News. Isha, I believe your mic is unmuted. Please ask your questions.
Thank you. I have two questions for Dr. Jarvis today. First one is, these questions were intended specifically for Mayo Hospital, but if you could just address it more broadly, that would be great too. Are you worried about possible transmission from President Trump's visit and all the people it'll bring to the area? And are you preparing in any way for that? That's my first question. And my second one is, are you concerned that all these protests that are happening in Maine is going to cause a spike in cases, and are hospitals preparing for that spike in any way?
So great. So the two questions were, are we concerned about the president's upcoming trip to the Guilford area, in particular for spread of disease, and two, are we part of the preparedness for that? And then the second question was about with protests or mass gatherings, are we concerned about transmission of this virus? So I'm going to kind of combine these two. I'll first start off with preparedness for the president's upcoming trip. Northern Light Health is honored to be a part of the preparedness for any kind of visit like this, but particularly for the President of the United States. Up in the Dover-Foxcroft area, Northern Light Transport at Mayo Hospital is prepared and has been working in concert with the federal government in preparedness for this trip. Northern Light Eastern Maine Medical Center, also as being the local trauma center and medical center for the region, also is prepared for such a visit and this particular visit. So yes, we are engaged and we will continue to prepare for any contingency. As far as transmissibility during that visit or during these protests, it is a concern when we see mass gatherings of individuals, particularly when they are not practicing social distancing or when they are not wearing face coverings. All of this is the same kind of thing that we talk about. And so whether it's a protest or a large gathering for a wedding or some other nice celebration, the risk is there, the risk is real, and we continue to reinforce to your viewership, readership, and listenership that it is important that they remain 6 feet away from other individuals, that they wear face coverings when they are out in public. That'll all help to prevent the spread of the disease. I am particularly concerned about some of the gatherings that we've seen, because we do know that when we vocalize by either yelling or singing, that produces more of those aerosolized particles, and therefore transmission can be even greater. And so I just caution everyone to think about that as they peacefully protest. Thank you.
Isha, why don't you, if you have another follow-up question, why don't you go ahead and answer it now? And since we do have a little bit of extra time, I'll give everyone else a chance. If you'd like a follow-up question, just let me know in the text box right there, and I'll try and jump in next. Isha, do you have any follow-up?
Yeah, I do actually. You mentioned that you've been, in touch for preparedness for President Trump's visit. Can you give me some specifics on that? What does that preparedness look like?
So
all the visitors are from out of state, and
So yes, so the question was, what specific preparedness are we looking for? And one, you're right that this will involve obviously people coming from out of our state, particularly from hot zones. But that happens right now as well. We do know that there are people who come in and out of our state. We have transport and delivery trucks and things like that. And so that's just a part of our day-to-day preparations. I can't go into any specific details about preparedness for the president's trip, because those are details that I am not privy to at this time. Just know that we work with both local, federal, and state agencies whenever we have a dignitary come into our area.
Thank you.
You're welcome.
Thank you very much, Isha. Okay. Looks like ABI 7 is all set. Brian, do you have anything else you'd like to follow up with? Are you all set? And can't unmute you, Brian. There you go. Do you have a follow-up question you'd like to ask Brian, or are you all set?
Yeah, just to clarify, I haven't had a need to be at the hospital recently. Just what are the measures that you talked about that are in place today that maybe weren't in there last week? Like maybe the screening or the question and answer, people come in, and I guess why you felt necessary to do that at this point.
So Brian, that's a good question. One, I'm glad that your health has been good, and we hope that that's the case for most people, but we know that there are those who will continue to need care and seek care with us. Really, we have not done much in the way of difference than what we have been doing for the last few weeks. We have updated our screening questions a bit, and there are a few more questions added to that list based on the CDC guidance, and so a little bit difference there. I think the difference really is, and the reason why we felt the need to do this, is that we are seeing an increase in our volume of patients. As we continue to take care of those time-sensitive, necessary procedures, we have increased in volume. And we know that there were those individuals with chronic health conditions who delayed their own health care and now unfortunately are needing to be seen and admitted to our hospitals. And so our volume across the state has increased in non-COVID related admissions. And so because of that, I think there's just more people coming to our facilities, and therefore we felt that it was necessary to kind of go over the same kind of protective things that we were doing. At the same time, we also want to make sure that the community at large feels safe entering our facilities. It sounds scary to know that there is a COVID positive patient in the hospital that you need to go to, and we want you to understand we will take every precaution we can to protect you from anything that may come to you from another person, such as isolating our COVID positive patients in a particular area of the hospital, us wearing, our medical workers all wearing face masks, and sometimes even higher levels of personal protective equipment and the like. And so really it's just letting people know that this is a safe time for you to come to the hospital if you need to come to the hospital, and we are here for you.
Thank you.
Brian, all set?
Yep.
All right, thank you. All right, Amy, last but not least, I think she's got one follow-up question. Who is this for, Amy?
This is for Dr. Jarvis. Thank you. I know you've done some myth busting in the past, and I think this is a myth, but I'm not sure. I remember early on there were concerns that if you had any symptoms that you thought you might have COVID, you shouldn't take Tylenol and certain other anti-inflammatories. And there's a list of ones that were supposed to be okay and ones to avoid. And the thought was that certain types of anti-inflammatories were making symptoms potentially worse. Has that panned out to be true?
That has not panned out to be true. So the question was when you do have mild symptoms, including fever or muscle aches, and taking Tylenol or acetaminophen or ibuprofen or Motrin, whether those are safe to do. And yes, they are. There were some initial reports that came out, particularly about ibuprofen, that have been founded to not be correct. And that it is perfectly safe, just as like we give you advice for treating influenza-like illnesses with acetaminophen or Tylenol or ibuprofen or Motrin, that those are perfectly safe for you to continue to do so.
Great, thank you.
No, thank you.
Thank you, Amy. Thank you, everyone. Thank you, Paul and Dr. Jarvis, for your time. And thank you, members of the media, for attending this press conference. Those of you who requested a copy of the video, we'll look forward to it in an email in about an hour or so. Have a good day, everyone.
Thank you.